Preliminary good news on the one hand, cases remaining steady, hospitalizations down. Balanced on the other hand with medical concerns still about reopening smart.
I'm still very concerned.
Dr. Harry Heiman with Georgia State University School of Public Health says from his medical perspective, it will be another couple of weeks before we will know the impact of Georgia's first steps in reopening.
There's pressure now to show that things are really okay in spite of our having reopened our state.
Dr. Heiman points to evidence of improving numbers statewide, but not yet, for example, in 5 metro Atlanta counties, specifically in Fulton, DeKalb, Cobb, Gwinnett, and Clayton.
All of those really haven't come down from their peak. I mean, it's flattening, but not coming down.
He says he's still cautious because the state is saying that its containment strategy won't even be fully in place until mid to late June.
That's the public health infrastructure that needs to be in place before you start opening things up, not kind of on the fly as you've opened things up.
But as the state does reopen, he says it's more important than ever for people to take the pandemic seriously and not let down their guard.